My name is Joe Kavanagh. I'm 62 years of age. I was first diagnosed with lung cancer in November of 2014, and I commenced treatment under Dr. Paul Donnellan here in the Galway Clinic on the 31st of December 2014. We had a regime of, the normal regime of, I think it was six sessions of chemotherapy. He had chosen a particular one for me, and I made the choice to attend for that here. I am from 60 miles away, but I prefer to stay here. And I actually have done that for all of my treatment for the last 3 years. So once we finished with the chemotherapy, we were then able to get Dr. Joe Martin, who was a radiology oncologist, to do an assessment following the chemo to see if it now enabled him to do some radiotherapy. There were complications because of lymph node cancer, some cancer in my upper shoulder, as well as the cancer in the primary site. We started very slowly with that, and effectively piece by piece. So we were making some moderate progress, but no remission or anything like that. We were managing to hold its own. And then Dr. Donnellan advised me one day that he said, these results, Joe, there's some positives here. So I'm going to put you forward for a clinical trial for a drug called nivolumab, a new drug for the treatment of lung cancer, but not for melanoma. So we got excited about that, but that actual clinical trial was delayed for a little while, and to Dr. Donnellan's credit, he got me the medication on a compassionate ground. I'm almost 2 years, I'll be 2 years in September, on the nivolumab. From the get-go, we saw some improvements, a stabilization and moderate shrinking. So we've had our regular CT scans. It's a bi-weekly treatment held here in the day ward in the oncology unit in Our Lady of Knock. The infusion itself for immunotherapy, or nivolumab is the drug, is 1 hour, but you have to prep your bloods and so on. And because it's such an expensive treatment, they have to be absolutely sure your bloods are right, your blood pressure, and they do it pretty much, you almost get like a medical every 2 weeks. The staff in Our Lady of Knock are just superb staff. They also go above and beyond. They're very helpful to facilitate your work-life balance. If you plan holidays, they know you personally, they care about you personally, and really they're very much a great team there. Equally, I would say the very same, and have said to Dr. Martin of the radiology department. They are just superb, they're very dedicated staff. So we continue with nivolumab, and after a while we could see some shrinkage, some more shrinkage. So we had taken the main threat out of the way, I guess, and we started to work on the shoulder and the lymph nodes in the shoulder. So again, one of the benefits that I personally feel about the Galway Clinic is that there was a surgeon available to me at very short notice, recommended by my oncologist, who was able to perform the surgery within 2 weeks. It's a pretty stable journey for the last year, but you have to live with the side effects, and the side effects can be tiresome. You can get some not so much nausea, but you can get itchiness, and you can get like a cold or a flu, and it can hit you at any time during your 2-week cycle. So you have to kind of have that flexibility built into your lifestyle. One day you may be just very tired, and you know, I suppose one of the things I have learned is that, you know, through going through this journey, is that it's different for everybody. Chemotherapy can be difficult for some. In my case, chemotherapy, I had some side issues such as chronic neuropathy. So it was decided to take my case to the MDM, which is a weekly rendezvous or meeting or review of different cases that are done here by the consultants and their teams. And Dr. Martin was in attendance, and presumably he presented my case. But what the team does is they take a much more detailed look. They have a more expert eye. They take a more detailed look. It's really to give the consultant the comfort that he's doing the right thing, or maybe to say to him an option that he may not have thought of. A stereotactic radiotherapy is carried out or performed only in Dublin by a specialist in one of the centres of excellence, and it involves very accurate imaging of the primary tumour, which is where they felt there was some activity going on there. And it's a process, it's a procedure which enables them to pinpoint really the centre of the site, the tumour, and give it very high doses of radioactivity in the space of a short time, and to effectively almost kill the tumour from within as opposed to trimming it on the outside. It also does far less damage to the other organs in your body. No surgery right now, certainly not stereotactic, because it's not active and they don't believe there's anything to touch. So the big question now is, you know, will we go forward and do surgery or not? And we don't know yet. But you know, what's very comforting about it is that if it does flare up, we know surgery is now an option.